Good, let's go to the United States. In the beginning of 2023, the United States as well came with guidelines, and this time published in Anesthesiology, and differing to, well, some extent for some details from the European Society guidelines. They start with saying that you should not rely on clinical assessment for judging, for assessing a neuromuscular blockade. You should use a quantitative monitor which is superior to qualitative assessment to avoid residual neuromuscular blockade. Recommendation 3 concerning residual blockade, we know that. Recommendation 4, we know that. Recommendation 5, they are very confident. They are very strict. They do not leave an opening. They say, do not use eye muscles for neuromuscular monitoring. That's, well, for sure, a quote, for sure, a statement, a recommendation that comes from Søren Bro, who is very much against using eye muscles, fascial nerve stimulation to assess residual neuromuscular blockade. Okay, in recommendation 6 is stated that neostigmine should only be used when the TOF ratio is greater than 0.4. Now remember the 0.2 in European Journal publication. And recommendation 8, US guidelines, is an interesting one. Recommendation 8 leaves an opening for those clinicians using benzyl isoquinolines and only use qualitative neuromuscular transmission monitoring. This recommendation states that extubation should be performed when the TOF count is 4 and not earlier than 10 minutes after neostigmine administration. This recommendation is still there because in a lot of small hospitals worldwide, not only in the middle of the United States of America, worldwide, not every operating room has a quantitative neuromuscular transmission monitor. And perhaps sugammadex is not always available over there at any time. Good. The US guidelines started in their recommendation 1 with telling to the reader that the major flows that may occur after clinical assessment of the neuromuscular blockade alone, without monitoring. Now, this is own work from many years ago, 2006, showing the very low sensitivity of several clinical tests with regard to the capability of diagnosing and reassuring a TOF ratio of 4.9. And the US guidelines continue with recommendation 2, with the importance, stressing the importance of quantitative monitoring. Now, this recommendation is for sure based on a large number of papers, but typically the position paper by Glenn Murphy, you see on this slide, a very important example of this. Look at this slide in a bit in detail, and about all of the respiratory variables. Upper part, during transportation of the patient. Lower part, during their stay in the post-anesthesia care unit. A very significant difference was found in favor of those who received quantitative monitoring compared with qualitative measures. And all is a consequence, the very right side of right part of the slide, all of this is a consequence of the fact that the TOF ratio at the end of surgery was significantly higher when quantitative neuromuscular transmission monitoring was used compared with an ordinary TOF count. Look at the spread, look at the outliers in the conventional monitoring group. Finally, it is of importance to notice that even when using sugammadex, neuromuscular transmission monitoring remains the Achilles heel of avoiding residual paralysis. Look at these tremendously important findings by Kotake. And congratulations to Kotake. He is a Japanese anesthetist, actually a bit discussing, actually a bit criticizing the practice in his own country. Japan is a typical example of a country where routine clinical care does not normally involve the use of a neuromuscular transmission monitoring to guide neuromuscular blockade, to guide antagonism. So he performed a study in which he compared, well, patients who had neostigmine, patients who spontaneously recovered, patients who had sugammadex, but without monitoring, fixed doses of neostigmine, fixed doses of sugammadex, or spontaneous recovery. And he found 4% of his patients who received sugammadex having residual paralysis. That's a huge incidence. That's a huge number. Everyone does not like to read this number. This is unacceptable. Although some of these anesthetists use quite impressive doses of sugammadex.